Meron po tayong tanong para kay Dr. Rabi. Which is more contagious or who can spread the infection to others more, the asymptomatic or the symptomatic positive cases?
So we have reiterated over and over again that this disease is transmitted largely by symptomatic people. The evidence that asymptomatic people are transmitting this disease is very weak. In our estimates, almost 90% of the disease is transmitted by symptomatic people, and so we need to focus expressly on those symptomatic people to maximize the benefit of the enhanced community quarantine that is now being implemented.
All right, Rocky?
Yes, but question for Dr. Rabi. There are reports from Italy and South Korea that the loss of taste, smell is an indication that one has contracted the virus. Has the WHO looked into this? Should the DOH also consider the symptoms in testing patients?
We have heard of these reports. These have not yet been confirmed. The focus should be on the key clinical features of this disease, which is largely acute respiratory infection accompanied by fever and sore throat. So a clear focus on these symptoms will be very useful in the identification and especially the isolation of people with symptoms. May I make this opportunity, use this opportunity to re-emphasize that people with those symptoms must practice physical distancing, isolate themselves from other family members, and the use of masks is recommended only for those people and healthcare workers at this point of time.
Okay, second question, Dr. Rabi. There is no medicine for COVID-19. What happens then to an asymptomatic carrier if he isn't tested or seen by doctors? Will he just shed off the virus?
So there are many reasons why we test people, and in the situation that the Philippines is right now, our recommendations are that the limited testing that is available be used to strengthen the testing of people who are symptomatic with severe disease, and also we use the testing to test people who have pneumonias and acute respiratory distress syndrome. This information is useful not only to confirm the infection in the people suffering the disease and to improve their management, but more importantly, this information needs to be used quickly for contact tracing and isolating people at high risk to limit further transmission. This is the way we can maximize now the benefits that are accrued by the enhanced community quarantine. So our recommendations now is to prioritize testing for people with severe pneumonia and acute respiratory distress syndrome, in addition to those people with symptoms of severe disease and underlying comorbidities and the elderly.